So in this video we're going to show you the lab part of the software. So it's actually where you document everything related to the oocytes and the embryos. And this part is a little bit complex, so it kind of cover everything that is typically needed for lab. And you have 4 buttons under this particular choice. So I have the lab summary, which actually gives you the basic information that you need to know. Hello and welcome back. So in this video we're gonna show you the lab part of the software. It actually contains all the details that need to be documented about the lab part, which means starting from retrieving the oocytes to the embryo transfer part. So if you click here, you'll find 4 buttons. It's a little bit complex here, so we have different choices to make it simple. So basically this is a lab summary. This is the first button, and actually it gives you the high yield information out of all the information that's present in the IVF lab button. So you probably gonna use it. But now it's empty, doesn't have anything in it. You can just add the retrieval date. Choose if it's a past day or if it's coming. Then you have to just document what the retrieval day will be once you know it. And again, you can click here to add it to the calendar, as we're going to discuss later. Now, these are the extensive details related to the lab. So starting with right ovary, left ovary, how many follicles were aspirated, how many oocytes were retrieved on each side, oocyte maturation, oocyte quality, the number of fertilized oocytes, and now this summarizes the growth of the embryos on day 3, 4, and 5 using different stages of embryo development, and at each stage of these you can enter how many were grade 1, grade A, B, C, D at each particular stage. And it always sums up for sure. So if you say there was 1 grade B, then it's gonna add 1, and here it's gonna be added as 1, and the total number of embryos is gonna be 1 for sure. So you don't have to worry about just making these sums, but you just enter whatever you think is important about embryo development in this part. And again, you can just do some random entries here just to test the software. Just choosing some very random numbers indeed. And then once I'm done with that, I actually can click here. And when I click here actually and check the summary, here we go. So you find these numbers going into this chart, which is very high lead, so it just tells you the very condensed information that you need. Similarly, if you go to this third one, you're going to find more information about the transferred embryos, the embryos that you already transferred or you're going to transfer, and the frozen embryos, so the embryos you're going to be freezing. So basically you can do the same thing. Was it day 3, was it day 4, was it day 5? So you decide, you tell how many were transferred. If you did that on day 3, just tell us how many were transferred and what grade actually. So I transferred 1 grade A and 1 grade B. And you can check from all these buttons what was the stage of these embryos. So saying, oh, that was a blastocyst, for example. Same thing can be done on day 4 and day 5. And for the frozen embryos, you choose the same way what day they were frozen and what were their grades, and of course what was the stage of embryo development, so it stays in the records. So you can always choose some random numbers again, and then again click here. So once you click here, it's going to be showing up into the summary. One last thing is actually genetic testing. So if you're going to do genetic testing, you need to check here. So that says pre-implantation genetic testing. So you just click on it, and then it's going to open what was the indication, what any notes about the procedures, what results did you find, and what recommendations would you like to make. And then you can also check that to indicate that you already did the pre-implantation genetic testing. If you didn't do that, just unclick it. So all this information is going to be saved in the patient file, so whenever you come back you can find this information. So I recommend that if you decide to do it, just click here. That indicates that you are gonna do it. So you remember that in this patient you have to be doing that pre-implantation genetic testing. That's pretty it for the IVF lab, and thank you.